Hello, I'm Dr. Jeff Williams with Creekstone Care right here in Amarillo, Texas. I've spent some serious time going through research abstracts, compiling a list, and battling to educate folks about chiropractic for several years now. And what I wanted to talk about in this video today is the topic of cervical chiropractic adjustments, which also means adjusting your neck. The one common thread some in the medical field seem to always come back to is this imaginary notion that cervical manipulation is dangerous. Not only that it is incredibly dangerous, but they'll say that it's being performed for very little payoff in the form of pain relief or reduction of disability. Meaning they claim it's dangerous and there's no benefit anyways, so why do it? So let's say this. That is simply untrue. No truth at all. Recently there was a young former Playboy model that passed away from a stroke. She was on the set at a photo shoot and she had a bad fall. All of the reports agree on this fact. Several articles go on to say that the model went to the ER and was released. The model then went to her chiropractor sometime after the visit to the emergency room. The visit didn't seem to help, so she visited a second time. After the second trip to her chiropractor, her pain and condition seemed to deteriorate from there. Ultimately, she was put in the hospital after suffering a stroke. She was later removed from life support and unfortunately passed away. Even one of chiropractic's biggest detractors wrote an article on this very specific incident, admitting that it is unlikely that the chiropractor had anything to do with causing this issue because this was in the carotid artery. A complication of this sort is exceedingly rare in the vertebral artery, but even far more rare or almost impossible in regards to the carotid artery. The incident was most likely caused by the fall missed by the emergency room and missed by the chiropractor, only to worsen and ultimately cause her death. This sort of tragedy is it's just that. It's a tragedy. Preventing even one such event is the goal of all of us in the healthcare field, regardless of your discipline, and my prayers go out to her family. You know, when something terrible like this happens and the word chiropractic is anywhere in the mix, the detractors start emerging and spouting a lot of told you so's and other nonsense. For example, you'll see and hear things like, this happens all the time. I'd never let a chiropractor touch my neck. It's a pseudoscience. I'm a nurse and I've seen this a lot. And on and on and on. And quite simply, according to research and evidence, these statements are false, biased, and baseless at minimum. At the most, they are libelous, slanderous, and absolutely hateful. Chiropractic as a pseudoscience. Let's talk about that. I think most people are reasonable. They understand that chiropractic was discovered or proposed as a treatment by D.D. Palmer, and the profession was furthered by his son B.J. Palmer. Some in the medical end of healthcare will point to those two guys and their assertions as a reason for people to turn away from present-day chiropractic. And I would say that, as with anything, chiropractic has greatly expanded and advanced in understanding and in what it has to offer, as well as in the research that backs the use of spinal manipulation, exercise, and mobilization. I mean, think about it. When chiropractic was first made into a healthcare treatment modality, medical doctors were still bloodletting. Let's just keep things in perspective. That's all I'm suggesting. And let's be clear. Many chiropractors refer to and accept referrals from medical doctors daily. This isn't a doctor of chiropractic versus medical doctor discussion at all. The attempt here is not to compare two different professions that deserve a great deal of respect, both of them. The goal is to educate about the benefits and risks of cervical manipulation and to keep things in proper perspective and context. That's all. As for the rest of it, we chiropractors, we have a daily list of anecdotal evidence for how patients respond to what we do, and we really don't need validation. However, We have the validation through research, and not just a little bit of research either, a whole bunch of research. Many of chiropractic's detractors they've built a life of comfort from their opposition to the profession. They own and operate big websites. They write articles and books. They give lectures and seminars opposing chiropractic, and I can promise you, regardless of what they say, there will never be enough research that comes out that will make them say, you know, my whole life I was wrong about chiropractic. They weren't the fools, I was the fool. Now I'm going to rethink my whole life and everything hateful I've ever said about chiropractic for the last several decades. That's just not going to happen, right? Let's be honest. No matter the research, quantity, or quality that supports chiropractic, they will continue the crusade by calling it rubbish and all kinds of other names so that they can continue with their lifestyles. But that's okay, as long as you know that most of this research is done by governments, insurance companies, universities, and medical doctors. You know, people that either don't necessarily have a dog in the hunt or people that downright don't like chiropractors. So I feel that you can trust the research. That's what I'm trying to say. There's a ton of it too, so to keep from completely boring you, I'll just pick some out and give you the conclusions to these papers. I think by the time I'm done here, I'll have made my points very clearly. So let's begin with the benefits of adjustments for the neck in particular. A 2003 study published in the British Medical Journal concluded that manual therapy or spinal mobilization is more effective and less costly for treating neck pain than physiotherapy, physical therapy, or care by a general practitioner. Now, this 2014 study by DeWitt et al., published in Manual Therapy, concluded, pending on these patterns, specific mobilization and manipulation techniques are warranted. The proposed patterns are illustrated in 3 case studies. This clinical algorithm is the corollary of empirical expertise and is complemented by in-depth discussions and knowledge exchange with international colleagues. Consequently, it is intended that a carefully targeted approach contributes to an increase in specificity and safety in the use of cervical mobilizations and manipulation techniques as valuable adjuncts to other manual therapy modalities. A 2011 randomized clinical trial by Dunning et al. And published in the Journal of Orthopedic Sports Physical Therapy concluded the combination of upper cervical and upper thoracic high velocity, low amplitude thrust or chiropractic adjustments is appreciably more effective in the short term than non-thrust mobilization in patients with mechanical neck pain. 2011 by Yu et al. Concluded chiropractic management of atlantoaxial osteoarthritis yielded favorable outcomes for these 10 patients. 2011, I'm going to torture this name here, but Puentedura et al., published in the Journal of Orthopedic Sports Physical Therapists, concluded patients with neck pain demonstrated a more favorable response when the chiropractic mobilization was directed to the cervical spine rather than the thoracic spine. Patients receiving cervical spinal mobilization also demonstrated fewer transient side effects. 2008, led by Jay Guzman, the Bone and Joint Decade 2000 to 2010 Task Force on Neck Pain and its Associated Disorders, published their paper in Spine Journal. It was made up of an international, multidisciplinary team of researchers that examined available research studies to determine the best treatments for neck pain. They found 17 studies that looked at various manual therapies. It found overall positive evidence for both mobilization and manipulation, particularly when combined with exercise. This led the authors to include mobilization, manipulation, and other manual therapies among the likely helpful treatments for simple neck pain. In comparison to anti-inflammatories, they also concluded anti-inflammatories such as aspirin, ibuprofen, Advil, those things, Tylenol. In comparison to those things, they concluded that there was not enough evidence to make a determination about the helpfulness of NSAIDs and other drugs. Now, for the benefits of headaches and migraines. 2016 by Dunning et al., brand new research paper that just came out and published in the Biomed Central Musculoskeletal Disorders Journal, concluded that 6 to 8 sessions of upper cervical or upper thoracic manipulation were shown to be more effective than mobilization and exercise in patients with chronic headache, and the effects were maintained at 3 months. 1998, Nelson et al. And published in the Journal of Manipulative and Physiological Therapeutics, the study concluded that patients who received only chiropractic care showed significant improvement on a par with those given the powerful prescription drug but without the side effects. The headache index from a diary kept by each patient in this study showed that chiropractic had reduced the severity and frequency of headaches as well or better than the combined therapy of amitriptyline alone, as well or better than the combined therapy or amitriptyline alone at each stage of the study. 2000, a randomized clinical trial by Tuchin et al., published in the Journal of Manipulative and Physiological Therapeutics, concluded that the results of this study support previous results showing that some people report significant improvement in migraines after chiropractic. Over 80% of participants reported stress as a major factor of their migraines. It appears probable that chiropractic care also has an effect on the physical conditions related to stress, and that in these people the effects of the migraines are certainly reduced. 2001 by Braunfurt et al. This paper concluded that chiropractic appears to have a better effect than massage for cervicogenic headaches or headaches arising from the neck region. It also appears that spinal manipulation has an effect comparable to commonly used first-line prophylactic prescription medications for tension-type headache and migraine headache. 2011, Duke University published a paper in Spine Journal and said the study adds to the support of chiropractic in moderate doses as a viable option for the treatment of cervicogenic headaches. So, clearly, the benefit has been established time and time again, and this is only some of those papers. I left a bunch out. If someone says there's no benefit beyond that of simple mobilization, massage, or exercise, then they are simply ignorant of the information, plain and simple. Now again, the gripe among some chiropractic detractors is that there's too much risk for no benefit. I've established the benefit, now let's talk about the risk, or the lack thereof. 2015, Kosloff et al., published in Chiropractic and Manual Therapies, they state the following: we found no significant association between exposure to chiropractic care and the risk of vertebral artery stroke. We conclude that manipulation is an unlikely cause of vertebral artery stroke. The positive association between primary doctor visits and vertebral artery stroke is most likely due to patient decisions to seek care for the symptoms, which are headache and neck pain, of arterial dissection. 2015, Whedon et al. Studied the risk of chiropractic in older patients. Now here's what they found. Among Medicare B beneficiaries aged 66 to 99 years old with neck pain, the incidence of vertebrobasilar stroke was too low to allow further analysis. Chiropractic cervical spine manipulation is unlikely to cause stroke in patients aged 66 to 99 years with neck pain. 2008, this one was a big one. Cassidy et al. Did a comprehensive study with 9 years of compiled information. 9 years. Vertebral artery stroke is a very rare event in the population. The increased risks of the stroke associated with chiropractic and primary care visits is likely due to patients with headache and neck pain from the vertebral artery dissection, and they're seeking care for the pain before the stroke. We found the Cassidy study found no evidence of excess risk of vertebral artery stroke associated with chiropractic care as compared to primary care physicians. I realize that some find research boring. I do not, especially when I'm in a branch of healthcare that is commonly and consistently attacked by others that are absolutely ignorant of the research. I guess you can say it's a necessary evil when we deal with things like this. Now, I hope I've adequately demonstrated through research that the benefits of cervical adjustments are most certainly there and that the risks are extremely low. But let's be clear, there are risks. There are risks with everything that you do, including walking into the street. However, when we are objective and we put things in its proper context, it's clear that the risk is minimal compared to the benefits. So let's do some comparing and contrasting here for the proper perspective. Let's talk about something as innocuous as acetaminophen, which we find in Tylenol, is responsible for 56,000 emergency room visits per year, 2,600 hospitalizations, and 458 deaths per year. That's just acetaminophen. Anti-inflammatories altogether are estimated to be responsible for 16,500 deaths per year. So again, let's keep this all in proper perspective. There are 70,000 chiropractors in the United States, making it the third largest doctoral level discipline in America. Yet, chiropractors still have the lowest malpractice costs by a huge margin. The reason is because there's very little risk in going to a chiropractor. It doesn't cost much to insure them because injuries just don't happen. If things like this happen all the time, chiropractic malpractice insurance would be sky high, yet it remains the cheapest. Looking at the graphic right here provided by the ACA, you can see that it's estimated there are 5 to 10 complications following adjustments in approximately 10 million, or about 1 in 1 million. As I've said, there are risks with any treatment you can imagine, including things as simple as exercise, yoga, massage, or just taking a Tylenol. But when kept in proper perspective and context, it's clear that chiropractic doesn't carry a risk near almost every type of treatment in the traditional medical path. To put the period at the end of the sentence, the Bone and Joint Decade Task Force Review concluded that in general, the physical treatments, including manipulation, mobilization, massage, and exercise, have good evidence of effectiveness and are very rarely associated with any serious complications. Let's cover some real quick symptoms of stroke and arterial dissection in progress. The sudden onset of a severe headache that's more intense than any headache you've ever had. A headache that's accompanied by blurred vision, double vision, trouble swallowing or speaking, or severe dizziness. Headache with numbness, tingling, weakness, or clumsiness in the arms or legs. Headache that is worse when you lay down. A headache in the temple area with pulsations, particularly in older folks. A headache accompanied by confusion, disorientation, or loss of consciousness. A headache with fever, vomiting, or severe stiff neck. So those are common symptoms there. But the point is, as you can tell, this situation has lots of different signs that cross over into other common conditions that patients present with. And it can be extremely difficult to recognize for anyone, be it chiropractor or medical doctor. Even for the emergency room that reportedly saw the Playboy model prior to her seeing her chiropractor. Now, if you've made it this far, you're a real trooper, and I appreciate you watching. I've only one other topic I'd like to discuss. Why would there be a faction of the healthcare world that holds such disdain for chiropractic that they would willfully ignore research and propagate lies about the profession, other than personal profit? Well, let me be honest and make an attempt at being completely objective here. I'd say it's partly because some chiropractors deserve it. If I were a medical doctor and I saw a chiropractor saying that they can cure cancer, I'd have a problem with that. Now, understand, I'm a chiropractor and I have a problem with that, okay? Many times those in the medical world, they see and hear about the worst of the worst for different conditions. How many times does someone waltz in to their doctor's office talking about how amazing their chiropractor is? It happens, but in general, patients go in to talk about what's wrong with them, not about what feels good on account of their chiropractor. Now that I've said that, I'll say this. Most of the reason there are certain circles of chiropractic detractors in the medical world can be traced directly to the American Medical Association. In a case called Wilt versus AMA, it was proven in federal court that the American Medical Association did the following or encouraged their members in the following manner. They said, encourage ethical complaints against doctors of chiropractic. Oppose chiropractic inroads into health insurance. Oppose chiropractic inroads in workmen's compensation. Oppose chiropractic inroads into labor unions. Oppose chiropractic inroads into hospitals, and contain chiropractic schools, conducting nationwide conferences on chiropractic, distributing publications critical of chiropractic, assisting others in preparation of anti-chiropractic literature, warning that professional association between medical physicians and chiropractors was unethical, and discouraging colleges, universities, and faculty from cooperating with chiropractic schools. Now you wonder why some people talk bad about chiropractors. This behavior started in the 1960s and was passed down to all of the state medical associations, then down to the individual practitioners in each state. This attack on chiropractic did not officially end until the 1990s, although I'd argue it isn't really over. The AMA lost the case, by the way. Considering this was proven in federal court, it isn't hard to understand or very surprising that the anti-chiropractic chants that come about every single time a tragedy occurs, no matter how rare it actually is, this stuff is going to continue. As long as people are educated to the actual facts, the research, and the stats, you should be able to keep the discussion and emotions that result from this sort of story in the proper context and perspective. I hope you've enjoyed this video. Please subscribe to our channel. Please share this video when you see this sort of discussion taking place. Thank you so much for watching. God bless. Till next time.